name is Reginald James Davis, MD. The technical term for this procedure is an interlaminar stabilization following decompression. This is a procedure where, quite honestly, many patients for coflex would be patients upon whom we might perform a traditional fusion. One of the advantages of this operation is that it avoids the fusion, but it stabilizes the spine. So in essence, the surgeon does, in a minimally invasive manner, a very small incision. This exposes just a tiny portion of the spine as opposed to the entirety of the spine. Through that tiny exposure, the decompression or the laminotomy, a removal of all of those tissues that are causing pressure upon the spine and upon the nerves is removed. After that removal, the coflex device is then inserted. It's a U-shaped device which fits in between the spinous processes, and at the base of the spinous process is the interlaminar space, which is very strong bone. And then there are wings which actually clip it onto the spinous process. And that simple insertion and clipping is all that it takes to implant the device. Oftentimes the surgery can be done in less than half an hour. That enables then the patient to receive the decompression, and so their stenosis, their back and leg pain emanating from the fact that their spine is being compressed is alleviated. Furthermore, it stabilizes the spine and helps control motion, which means the back pain of the abnormal motion or the excessive weight on the facet joints is alleviated as well, and that relieves the patient of a great deal of pain. The ideal candidate for the coflex procedure can be identified in two ways. This is the person with spinal stenosis that has pain and heaviness with exertion, pain in their legs with activity that especially gets better when they lean forward or with sitting. This is a very novel procedure. It was first introduced into the United States about 10 years ago. I was one of, if not the first surgeon to implant it in the United States, and I was the lead investigator in the clinical trial that led to the FDA finally approving this device for use in the United States.